shaking, pins and needles, fatigue and weakness, nausea, vomiting, loss of appetite, sleepiness, feeling tired, headaches, muscle spasms, twitching. All these could be symptoms that you have a low magnesium level in your body. Did you know that? Be careful. If you have these symptoms, you might have low magnesium levels. Articles mention that magnesium might have in between 400 to 600 functions in our body. And it's not that it has 400 benefits, it's that it has 400 to 600 functions, that they can be in little and specific parts of little and specific processes going on in our body. But magnesium is very, very important for our health. But today we live in a world that it's very deficient in magnesium, and there are a lot of reasons. Most of it's because of our diet and because of the water that we drink. How do we get magnesium back in the days? Back in the days, we used to get magnesium from the water when the water was coming from the spring, coming down in the river, and it was gaining all the minerals as it was coming down, and we used to take that water and drink it. And that was enough for us to take most of the magnesium that we need, which is something around like 400 milligrams per day as a minimum dose. And the other source, which is very common, is when we take leafy greens. There are other sources like chocolate or bananas or almonds or different kinds of nuts, but when we take leafy greens, that green, the green that we see in the chlorophyll, that it's very, very high in magnesium, and that's one of the most common natural sources in which you can take magnesium in your diet. But what happens today? All the water that we drink, it's highly treated. It has just chloride in the water, and the rest, it's just crackers, gummy bears, canola oil, French fries, and all the processed food that we're eating today, they lack of magnesium. So there are some studies that say that people in the Western world, in between 60 to 80% of the population, lack in good magnesium levels chronically. So try to picture your life without having headaches or joint pain or insomnia or sleeping bad or being tired all the time or not having any inflammation or muscle pain. All of this could be real when you have good magnesium levels. I'm not saying that it's a miracle for everyone and that it's going to help everyone and it's going to be the solution for everyone. But for most of the people, or for a lot of people, when they have low magnesium levels, this could be really, really helpful. So in this video, I'm going to tell you all the benefits of magnesium. In this video, I'm going to tell you how much magnesium do you need, what's the best way to take it, which are the best sources of magnesium that you can take in your diet, as we just mentioned, but also in a supplement, which is the best way to take magnesium. Is it better to take it in the morning? Is it better to take it at night? How can you measure or how can you see if you have low magnesium levels or if you have high magnesium levels? Who cannot take magnesium? Who's in danger of taking magnesium? And I'm also going to tell you, how do I take it day by day? Can my kids take magnesium? So stick with me till the end. Please remember that magnesium is a part of in between 400 to 600 little biochemical and physiological processes in our body. It's all through the literature. I'm not making it up. You can look for it. It's a very important mineral inside of our cells, and it's very important for a lot of functions. And we lack of magnesium because of our diet and because of the way that we consume water today. If you want to look for benefits of magnesium, you're going to find them wherever you want. For concentration, headaches, depression, migraine, muscle pain, muscle twitching, for your metabolism, to activate vitamin D.
For your immune system, for your colon, for your bowels, the production of acid inside of your stomach, for your skin, for youth, for your telomeres, for anti-aging.
I mean, we could stay here long enough just mentioning all the benefits that you're going to find in your health. So could you cure a disease by just taking magnesium? Maybe not. Maybe not cure a disease, but it could be very helpful for a lot of diseases. Because when people get, arthritis, is it going to help? Of course. If someone is diabetic, is it going to help if they lack magnesium? Of course, because magnesium is very important for the release of insulin. So, and it'll help insulin to be more sensitive in the tissue, so it's going to work better. and it's not going to have the same resistance. If you want to see, we could stay saying every single disease, how is it going to work? For autoimmune disease, is it going to work?
Of course.
In cancer, is it going to work?
Of course.
In every single disease, go to PubMed and look.
Cancer and magnesium, autoimmune disease and magnesium, arthritis and magnesium, diabetes and magnesium.
And you're going to find, of course, a lot of literature of the importance of this mineral in our body. It's not going to cure anything, but may magnesium prevent me to get any disease? Well, if it's working in 600 processes, physiological processes in our body, for sure, having a good amount of magnesium, it's going to be very helpful to prevent acute and, of course, chronic disease. A question that I get a lot is when people say, hey doc, why should I take magnesium if I measured my magnesium in my blood and it was good? It was okay. So my physician told me that I shouldn't take magnesium because the levels were okay. Please remember this. From all the magnesium that we have in our body, 97% is going to be inside of our cells. From the part that it's inside of our cells, that 97%, most of it, it's inside of our bones. And our bones are very, very jealous with the level of magnesium that we have. The rest is inside of the other cells, in which magnesium, it's super important. All the functions that magnesium has, it's especially intracellular, inside of our cells. So the amount of magnesium that we're going to find in blood, which is extracellular and intravascular inside of our blood, it's very low. So for instance, take a look at this table. Imagine this is a cell. I can have low magnesium inside of this cell, and the outside, it's going to be exactly the same amount. Or have a good amount of magnesium inside of my cell or inside of my bone, and the level of magnesium, it's going to be exactly the same. So what does this mean? That the level of magnesium that I have outside of the cell that I can measure in my blood doesn't reflect the real amount of magnesium that I have inside of my cells and inside of my bones. And they have tried to see different tests. Magnesium in red blood cells, magnesium in blood, magnesium in the relation when people take calcium and they do a ratio in measuring in urine, but it's not very helpful. So today, the best way to see if you may lack of magnesium is check your diet and look at symptoms. Symptoms as the ones we've been saying all over the video. If you have cramps, twitching, muscle pains, insomnia, if you feel weak, depression, chronic constipation, gastritis, if you're gaining weight, if you have thyroid problems, all of those can be related with low magnesium levels. So, and one of the things that are very beneficial is to give it a try. If you give it a try, if you take a good magnesium source and you give it a try and you feel the difference, if you feel a relief of symptoms, then probably you did have a magnesium deficiency. And what can you do? You can load up your body again with good magnesium levels, and then you can see if you can stick with that in your diet. So there are two ways in which you can find magnesium. One is in your diet. In your diet, taking what? Leafy, dark leafy greens, like veggies, like kale, spinach. You can take chocolate that it's very high in magnesium. You can take almonds, walnuts, very high in magnesium, and you could take magnesium in your diet and take it in a supplement. Remember that in supplements, they come in a very different variety. So you can find magnesium oxide, magnesium citrate, magnesium glycinate or bisglycinate, which is the proper way of calling it, taurate, threonate, aspartate, malate, and it depends on what is related to magnesium to the function that you're going to find in your body. So which are the sources of magnesium that I don't recommend for you to take? I don't recommend for you to take magnesium sulfate or magnesium oxide because those are going to help you having diarrhea. And you might say, oh, that's good for me because I'm chronically constipated. Yeah, if you have one episode, it's fine. But if you take every single day magnesium oxide or magnesium sulfate, then you're going to end up with diarrhea and you're going to be getting all your microbiota, the good bugs that you have in your bowel, away. So please try to avoid magnesium oxide. It's the cheapest, and it's probably the one that you're going to find more easily. If you see that in front it says chelated magnesium, please take the bottle and turn it and see, most of the time it's going to say magnesium oxide, and this is the kind of magnesium that you don't want to take because you don't absorb it. Then you're going to have just magnesium getting inside of your mouth, and then you're going to eliminate it in your bowels, of course, because it's producing diarrhea. So which are the sources that I think that could be the better for you? If you want to get a wide variety of functions, I recommend for you to take magnesium citrate, which is probably the one that absorbs easily and the most. You're going to find benefits for your sleep, for being tired, for twitching, for cramps, for chronic constipation, for gastritis, vitamin D, and all the functions. If you want a wide variety, but especially for neurological symptoms like twitching, cramps, feeling tired, and sleeping, but not constipation, you can go for magnesium glycinate, which is very common and very well tolerated, but it's not going to help you with constipation. Please remember that, because I've seen patients saying, I took that magnesium that you were recommending and it didn't help me with constipation. And I was like, okay, what are you taking? Glycinate. Yeah, of course, it's not gonna help you because you're not taking the right combination. You might go for malate, which I'm gonna talk to you in a moment, or citrate, which is the best way. The third one is magnesium malate. Malate, it's been also related with a wide variety of functions, with a wide variety of symptoms, but it's also been very related with hydration. The kind of magnesium that you might use for hydration when you mix sodium, potassium, magnesium, other things like glycine for hydration to drink with water when you're chronically dehydrated, when you have diarrhea, vomiting, when you're sweating, exercising, or any other cause of dehydration. When you take magnesium malate, it's one of the best sources for high absorption. And the other source that I recommend is magnesium threonate. Magnesium threonate is when you have especially neurological symptoms, but central nervous system neurological symptoms. What is that? If I have depression, if I feel tired, if I want it for concentration, if I have horrible migraines, but everything inside, like think if you want magnesium inside your head, not neurological outside, but inside your head. When you want that, you might go for magnesium threonate or go for a mix. But don't go for magnesium that is mixed on the same preparation. Remember, this is not math, this is chemistry. So if you think, I'm going to go for a source of magnesium, when they mix citrate, glycinate, malate, threonate, all in the same capsule, don't go for that. Go for sources when you take it by itself, or maybe when it's mixed with something else. Magnesium and potassium, that's a very good mix. Or magnesium and lemon, or magnesium or something else. But don't mix different sources of magnesium because you might not get the benefit that you're looking. In the same capsule, you might take them in a different moment during the day. For instance, I want magnesium for relaxation, for my blood glucose, for my intestine, my bowels, and I want to take citrate. That's perfect. But I want to take magnesium also for my concentration and to sleep better, so I'm going to take glycinate. May I take citrate in the morning and glycinate at night? Of course. Try to drink it maybe 1 or 2 hours apart in any time of the day that you want, but don't take them at the same moment because you might not find the effect that you want. So what's the dose that you should be aiming for? At the beginning, if you see that you might have chronic deficiency because you go and see the symptoms and you check on your diet and maybe you think, yeah, I haven't been taking my veggies for a while, like we men sometimes do, that we don't take veggies at all. We're like chronic babies and we don't take veggies. Then you might start for a gram and a half, 800 milligrams. Please always, of course, discuss it with your physician. But you might want to get more magnesium inside of your cells. So you might want to reload or load your body with good quantities of magnesium. After that, the amount that you need on a regular basis is 400 milligrams of magnesium, not of magnesium citrate. Because when you go, what's the difference? There's a difference in between elemental magnesium and the combination of magnesium that you're getting. When you take magnesium citrate, for instance, maybe 40% could be elemental magnesium and the rest is citric acid, the citrate which is attached to the magnesium. So having said that, if I take, 800 milligrams, 300 is going to be elemental magnesium and the rest is going to be the citrate. The same thing with glycinate or the same thing with any other. But try to see that you're taking somewhere around 400 milligrams at least in between your diet and in between the other sources that you're taking, and try to measure when your symptoms are going away. And you might think also, what happens if I take too much? Is it dangerous if I take too much magnesium? Well, studies show that it's not dangerous at all, because if you get to a high amount of magnesium, everything that it's filling up the glass, you're going to eliminate all that magnesium in your bowels. So what's the worst case scenario that you're going to have if you take too much magnesium? You're going to end up with diarrhea. If you end up with diarrhea when you're taking magnesium, it's one out of two. Or you're taking too much, or you have a bad stomach in which you don't have enough acid to absorb the magnesium. So what can you do? You can take magnesium with lemon water, or magnesium with water with a little bit of apple cider vinegar. That will help you to assimilate properly the magnesium that you're taking. We eliminate magnesium through our urine. It's very common for people to eliminate magnesium in the urine, especially, for instance, when women are during pregnancy, they eliminate even more. That's why they get some of the twitching and some of the gastritis is caused by the lack of magnesium, that it's normal during pregnancy. That's why women during pregnancy need to take a little bit more magnesium, because they are eliminating more. But if I'm eliminating magnesium in my urine through my kidneys, what happens if I have a kidney disease? Some nephrologists say that you should be aware of the magnesium that you're taking and that you should restrict the magnesium that you're taking, and they're very dangerous because you might get a hypermagnesemia or high levels of magnesium. But again, there is a recent study, very recent, saying that this might not be true, and now that patients have a problem in their kidneys, maybe some amounts of magnesium might be very, very helpful. But again, we need to see a little bit more evidence. So remember, if you have good magnesium levels, you're going to be sleeping better. You're going to be more relaxed. Your muscles are not going to hurt at all. You're going to have a better metabolism. You're going to have better digestion. It's going to be better for your memory, for diabetes, gastritis, for your immune system to get more energy. Really, magnesium, I've seen it for me and for my patients. It's a real wonder. And I told you that I was going to tell you how do I take it. So I love veggies. I take veggies all the time. I take big salads because all of the benefits that I get from the fiber, from potassium, from minerals, but of course from magnesium. And I take 3 different sources of magnesium in my diet, and it depends on my days. Sometimes I take magnesium citrate because I find it very good for my digestion. Sometimes I like playing soccer and I like lifting weights, so I use it if I'm going to play soccer and I'm going to be dehydrated or I'm going to require a lot of hydration. During my training, I take magnesium malate. And when I go to sleep, when I want to recover, I take magnesium glycinate. So those are the 3 that I take during the day in different moments. And again, when I'm sweating, if I'm doing more exercise, I might be losing some sodium, but I might be losing some magnesium as well. So when I use it on my diet and I do a good supplement with citrate, glycinate, and malate at different moments, that's the way that I use it day by day. So as you can see, the health benefits for magnesium are a very wide variety. And again, when you start taking it, and if you feel the benefit, please know that it comes from getting good amounts of magnesium in your health and back in your body. And please remember that the most important way to get magnesium is through your diet. But if you feel like you need a little help, a little compliment from a supplement, please don't hesitate to take it. And please tell your doctor or your physician or your healthcare provider that you're taking it and that you're feeling the difference, because you really, really are going to feel the difference and you're going to see the wonders of magnesium in your health. And if you feel that this information is useful, please remember that the best way to support us, it's very easy. Please share it with your contacts. Please remember to hit the like button, subscribe to the channel, and hit the bell so we can tell you and be in contact with you every time that we make a new video.